Hi, virtual audience. My name is Kate Wilson. I'm the CEO of the Digital Impact Alliance for about 2.5 more weeks. Prior to that, I was the head of the Digital Health Solutions team at Path.
So you've had a long, storied career in all things. No, it's not over, but you've come a long way and you've done an amazing work, Kate. So we haven't had a chance to really talk about what you want to talk about. So I might just put you on the spot and say, what excites you as you think about turning the corner into 2023? Like I said, you've been at this work a while. You've obviously been very close to the digital health community. What are the things that feel new, that feel different, that feel hopeful? What gets you up in the morning and excited?
Thanks for the question. And I think some of it reflects really on the session that we did yesterday with Tanzania and with Ethiopia. And essentially, and then great sessions I've seen here today from Indonesia in particular. You're really seeing this movement where digital health has built a lot of the infrastructure that could be used and leveraged by their national governments, or you're seeing national governments sort of put in place national digital public infrastructure, the ID layer, the payment layer, data consent layer. And I think what's really exciting to me is to see how far in a decade those two things have come to kind of coming together. And I think what I hope is, and what's next, is actually that those two things come together and meet in the middle, where governments are really reflecting on the investments that have already been made from the donor community and beginning to say, hey, how can I leverage many of those things? Some of it through the work that Dial does with our partners, ITU, Germany and Estonia on the GovStack initiative, and how do you put in place that sort of national digital public infrastructure layer, but then how do you leverage the best of what already exists?
Yeah.
And since we're the stewards of the digital principles, it would be nothing without a shout out to the digital principles that we are actually reusing a lot of that. And I just want to take a moment to also say thank you to you, Nick, and to the entire Tech Change crew for all the great work that you guys have done and the fantastic work you all have done sort of helping promote the digital principles around the world. Thank you.
Well, Kate, it's been so great to work with your team and Dial with you over the years, working on materials for the donor trainings, building all kinds of toolkits and other trainings out for the digital principles. I even saw that one of the posters here, I don't know if you saw this, was basically helping to figure out how to take the digital principles training materials and make them more accessible for blind populations. So I love that there are all these things springing out based on the foundation that we've built. You mentioned GovStock, you mentioned digital principles. Is there anything else that you've worked on at Dial that you want to highlight, maybe that relates to digital health, something that you would love for folks who are watching remotely here to explore, to check out, that you're really proud of at Dial?
Thanks. Yeah, I would say it relates to digital health, but again, our work is much more cross-sectoral. So we look at what does it actually mean for a country to kind of take a whole of society approach to actually integrating all of their information systems together, really built on the principles from what I learned doing it with digital health, which is you might be able to fix your sector, but you still have people as a citizen, and those citizens need access to services, health services, agriculture services, signing up and voting. All of those things are integrated around you as a person or me as a person. And so I think some of the work that I would really give a shout out to, and we'll be putting out some work on this in the Q1 of next year, is actually work that the team has led with the government of Sierra Leone. And we went in with a very deliberate idea that the government should always and completely be in the lead of their national digital transformation story, but we helped them put together and put in place, 4 key implementing regulations and strategies that would then be used for their national digital transformation, trained with 21 enterprise architects, and then they've published out an enterprise architecture blueprint. And our partners, Smart Africa, GIZ, ITU, and others are starting to take that national approach to look at how can you help bolster efforts like Indonesia was showing us today, or Tanzania has tried to implement, where you're taking a national approach and you have national level actors that are putting together to leverage health. So I think health and digital transformation get stronger when they come together.
I think that's a powerful message to leave with. So we thank you, Kate, so much for the time that you share with us, and looking forward to following along in your journey as things evolve. But what an amazing tenure at Dial.